All right. Well, good morning. Thank you for being here on this Friday, Friday before Thanksgiving, nonetheless. So this is our compensation and benefits action group meeting. If you haven't met me before, my name is Brooke, and I am a workforce and sustainability specialist on the workforce unit team. I have lots of folks from my team here helping me monitor the chat and drop some links. And so we're going to go ahead and get started. Just a quick look at our agenda today. We're going to do just our normal welcome and attendance that we typically do. We had a topic request poll that we ran in September that we're going to go over the results really quickly, and then we're going to jump right into the winner of that poll and give you all some information on direct primary care, sometimes called concierge medicine. Then we have some information on the Direct Care Workforce Strategy Center technical assistance we're doing. Heather's going to jump into some information for that, give you all a chance to get involved and provide some feedback. And then we'll have time for our open forum and then resources and closing before we let you out of here. So with that, I'm just going to jump into some real basic housekeeping. We are recording. Again, this is a smaller group today, and so we really want to make sure that we make this recording available to folks who weren't able to join us in real time. So that's just a reminder to avoid sharing any protected health information. We will collect all the links that are shared in the chat and share those out as well. But yeah, just a reminder to be cognizant of what we're sharing today. You're welcome to use the chat. Again, we're going to use it to drop a lot of links and information for you. You can ask questions, you can drop thoughts, anything that you'd like to use that chat for. I have, again, a handful of folks here helping me monitor that chat. We will be sending the slides out after the meeting. Typically, we get those out to the group that is on the Google invite. And so if you got the reminder earlier this week and the agenda, then you'll also get the notes and the follow-up. If you didn't get the agenda and reminder and you'd like to be added to that listserv, I'll go ahead and drop our email address in the chat there. Just shoot us an email and say you'd like to be added, and I can get you added to that. And that'll ensure you get the slides and the notes from this meeting as well. If you're listening by phone, welcome. *6 to unmute your line or *9 to raise your hand to participate in the conversation. We'd love to have you. I've turned on closed captioning. You can turn that on and off on your own screen using the black Zoom toolbar there at the bottom of your screen, or at least it's on the bottom of my screen. And then meeting information for this meeting, as well as our other Direct Care Workforce Collaborative Action Group meetings and the quarterly collaborative, can be found on that website. There's past recordings there, there's slides, there's resources. It's a great website to go ahead and bookmark. And then in addition to that, we also now have our Direct Care Workforce page, which includes the collaborative, but also all the other work in this space that we're doing as a team, and just has links to all sorts of information within the department that we're working with. And we're happy to share that with you and have a place for all of it in one. So with that, I'd just like to do a quick welcome for folks if this is your first meeting. So welcome, first of all. This is an action group of the Direct Care Workforce Collaborative. There are 3 action groups: training and career advancement, compensation and benefits, which you're in now, and then value and awareness. We do also have the quarterly collaborative, and we'll talk a little bit about scheduling of that here towards the end of the meeting. But these action groups are bi-monthly. They are stakeholder-led or stakeholder-driven, meaning that you all get to determine kind of what fits for the agendas, and then HICPUF facilitates. So that's what I do, is I help facilitate the meetings. We make sure it's recorded, we make sure notes are captured, links are captured, that kind of stuff. Each action group has 2 stakeholder co-chairs that help with agendas, help spur discussion, really help us determine if the agenda topics we're bringing forward fit the need and fit the group. And they kind of get to see the slides and things beforehand as well. So I'm not sure if Ashley or Britt, either one, are able to join us quite yet. But if they do, I'll be sure to shout them out and you get a chance to meet with them as well and chat and learn about them. So the purpose of these action groups is really to take the information that we push out in the Direct Care Workforce Collaborative. The quarterly meetings are really information dissemination, and these action groups really take that information and put boots to the ground. And so this is where we get a little closer to these topics and we're able to do a little bit more work. It's typically a smaller group, and so we're able to provide a little more feedback, have a little bit more discussion, and just really decide what makes sense and how we can best help. Stakeholder voice is paramount. It's the most important thing. Not only to have a say in the agenda topics we have, but to have discussion as well. And so please participate in whatever way you are comfortable, because we'd love to hear from you. And we also have an opportunity later on. We have a survey as well related to the technical assistance. So if you're not able to speak up today or don't have thoughts today, we do welcome continued engagement kind of in different ways as well. So we'll talk about that a little bit later. I think with just 10 of us here, I'm not going to actually run the poll, but what I will ask is if you put your name and agency or your role in the chat, and then if you wouldn't mind putting the county that you live and or work in. That way that'll help us capture that demographic information that we normally pull, but I'm not going to worry so much about having the poll question and showing us those results. So I'll give folks a few minutes to just roll call in the chat for me, your name, your agency and or role, and then the county. All right. We'll let folks kind of do that. And I will jump right into our first agenda topic, almost on time even, which is great. So in September, we had a topic request poll where we presented a handful of different topics. A lot of them spurred from a webinar that a handful of us attended over the summer that was best ways to support direct care workers, kind of thinking outside the box. And so we brought a couple different topics for you. I do have the link to the notes that I'm going to drop in the chat for y'all. If you weren't able to attend that meeting and you want to look at the presentation we had for that, you can click on those notes there to see the different topics that we brought forward. And basically what we asked, we presented on a handful of topics, gave an overview and said, okay, what would you like to see from this group as topics for the next couple of meetings? And so we did go ahead and run a poll. We left that open too after the meeting, so folks were able to chime in after the meeting too. So if you weren't able to join, you were still able to say, hey, I want these topics covered. And what we found and what we had, these were the top three that we had. So we had direct primary care or concierge medicine, creative benefits packages. And so we're going to do some information on that. During that webinar this summer that we attended, it was a national webinar. People are dropping links to different creative benefit solutions in that webinar. So we collected a handful of those. And so we have some information to share on creative benefits at a future meeting. And then Colorado ABLE accounts. And so those are for individuals typically with disabilities that are on some sort of Social Security, but it allows them to have a savings account that doesn't directly impact their benefits. And so it's a separate account that they're able to have money in up to a certain limit, but it's separate from what their income limitations is for their benefits. And so it just allows a nice way for folks to be able to save and have a nest egg without impacting their benefits. And so that's a Colorado program. There's similar ones across the state, but that was an interest as well. So those are the top three that we got from folks. And the top one, kind of by a landslide, was direct primary care or that concierge medicine. And so what we've done is we've done a little bit of research for you. And I'm going to go into some information on direct primary care today and just share a little bit of an overview, where to find some more resources, and really just dig into this topic a little bit more for you, both as individuals, but also if you happen to be a provider or an agency. Hopefully this information will be helpful for you as well. So I'm just going to check the chat, make sure I'm not missing anything before I hop in here. So we do just want to give a disclaimer. We're sharing this information for awareness only. We don't endorse direct primary care or any individual clinic that's offering direct primary care. The statements reflect individual experiences and may not apply to everyone. We're not responsible for how this information is interpreted or used. We're not telling you to go out and do direct primary care. This was just a topic that our stakeholders were interested in, and so we wanted to bring that information to you. So all of this stuff was found honestly by a Google search. And so we've just collected it all for you here in a nice, neat little package. But yeah, we're not endorsing anything. We're certainly not endorsing individual clinics. This is just informational. All right. So what is direct primary care or concierge medicine? I'm going to call it direct primary care because it's easier for me to say. But what is it? It's membership-based primary care. And so patients typically pay a flat monthly or annual fee directly to a clinic. So there's no insurance billing for covered services. There's no copays. There's no deductibles. None of that happens at the point of care. You pay a monthly fee to a clinic to access their services. And those services typically cover most or all primary care. So office visits, basic labs, care coordination, virtual visits, whatever they're able to do within the walls of that clinic, you're essentially paying for access for. And so you're not having to wait or reach a deductible. You're not having to pay your copays. You could pay your monthly fee and show up to this office a handful of times, and it's all covered within that monthly fee, depending on what they're able to offer within the walls of their clinic. So a little different model, we would say, versus traditional insurance. I've pulled together just a side-by-side comparison here, direct primary care versus traditional insurance. So on the left, you'll see that direct primary care offers a direct contract between the patient and the clinic, or an employer also can purchase this for their employees, and we'll talk a little bit more about that later. But it's a contract between the patient and the clinic. Whereas traditional insurance is the insurer pays a provider per visit or per procedure, so it's at fee for service. So you're paying something every time you go. Direct primary care offers a flat membership fee, again paid monthly or annually, while traditional insurance offers members that pay premiums and copays and deductibles. So it's not that, again, you're not paying every time you go through the door. It's covered in your monthly or annual fee. Direct primary care, by research, often offers same day or next day appointments and longer visit times, while traditional insurance scheduling and visit times may vary by provider or service type. So depending on what you need or what kind of service you're asking for, sometimes that can be next week or it can be next month. But typically for these primary care visits in these smaller clinics, same day or next day appointments and the longer visit times. From what I could read online, it's basically because they just have a smaller pool of folks that they're serving. Instead of being part of an insurance network, they're only serving the people that are paying their monthly or annual fee. And so they have a little bit more flexibility with scheduling and time. Direct primary care is focused on ongoing primary care, including prevention, chronic disease management, and basic procedures, but it does not cover things like traditional insurance, where primary care visits are just one of the many covered services in a large network of different providers and types. So direct primary care is for that primary care doctor clinic visit only, whereas insurance, you may have emergency room coverage, or you may have surgery coverage, or you might have imaging coverage. That's a whole network of different providers and services, whereas direct primary care is just a singular one. If you take nothing away from this presentation today, take away from us that direct primary care is not insurance. It's not. It's supplemental, and it's made for folks. And we'll talk a little bit about who it's for, but it is not insurance. In fact, Colorado law creates a separate category for direct primary health care agreements. It's not even considered. It doesn't have the same requirements that insurance does. It's a completely separate thing within Colorado law. Direct primary care agreements generally cover only those primary care services. Again, do not pay for hospital, emergency, or specialist care, and again, are just paid by those membership fees. And so we're really hammering home that it is not insurance. It is very different than insurance, but that doesn't mean it's not valuable. People still need separate comprehensive coverage, whether that's an employer plan, Medicare, Medicaid, or a marketplace plan. If they want protection for high cost care, you have to supplement your direct primary care with something else for those additional high cost visits and care. So all that to say, why might an employer be interested? Why would this maybe be interesting for someone? Employers themselves can contract with one or more direct primary care clinics to provide membership at low or no cost to employees. And so here on the Western Slope, we know that a couple of our employers contract with a direct primary care clinic, and they pay that fee, that monthly fee, for all of their employers. And so they may have a negotiated rate with that clinic where they're like, hey, we'll give you 10 of our employees and pay you $10 a month instead of $15 a month. They can negotiate those conversations with folks. But anyways, it's like a way that they can offer membership at either a low or no cost to their employees. They can do cost sharing. They can pay for the whole thing. They can really have a lot of flexibility in how they work with these clinics, because they're not at the hands of another insurance company. It's just a contract between those two folks. So potential benefits for employers: better access to primary care, fewer urgent care and ER visits. So you're encouraging like a healthier pool of folks having that prevention and that opportunity to see a primary care doctor. The cost is more predictable. You have that flat per member fee that you're paying each month. versus whatever your insurance premiums and things could be through changes. And it may just support workforce recruitment, retention, and satisfaction if you're able to say, hey, I offer this. This is something that we're able to offer for you either at a shared cost or at no cost. And you're just able to say this is just one other part of a benefits package that might interest folks. And this is a special note too. So recent federal tax laws allow many workers with a high yield savings account, or not a high yield savings account, a health savings account, to many HSAs, health savings account eligible high deductible plan to use those funds for direct primary care membership. So a lot of our providers that offer only high deductible plans sometimes offer health savings accounts in addition to that, just to kind of help offset the costs. And so what they're saying is this recent law change is saying that those health savings accounts can be used for that monthly fee that you're paying for the direct primary care. So that's just an option for another way to kind of leverage the different benefits you have to make sure folks are getting consistent care with a primary care doctor. Let me just check the chat. All right. So who are these plans best suited for? This is kind of a little bit of repeat information, but again, just trying to drive home the fact that it is not traditional insurance and it may not be for everybody. So it is best suited for individuals and families who prefer consistent care with the same primary care clinician, like being able to get appointments quickly and having enough time during visits. Again, a lot of primary care clinics offer same-day appointments, and so that's not saying that direct primary care is the only one that offers same-day appointments, but sometimes you can get that quicker than you do with your insurance visits. And then have high deductible plans and often pay out of pocket for primary care anyway. So you may have a health plan that just doesn't cover those visits anyway, and so you're paying out of pocket for those. And so this is just a nice way to be able to supplement something that you're paying for already, and it's covered in that monthly fee instead of at each visit. It may be helpful for small and mid-sized employers seeking, again, more predictable primary care spending. It's the same fee every month. Improved access to primary care for your employees, so just offering it again as part of a benefits package, and a chance to lower healthcare costs, such as those emergency room visits or hospital stays. And so just offering it to your workers as just part of a more holistic package can help with health outcomes for your employees. Not saying it does for sure, but just saying that it's a nice supplement to have as you look at your entire benefits package for your folks. It's also best suited for people with stable or moderate health needs who can pair direct primary care with employer coverage, Medicare, Medicaid, or a marketplace plan, or a plan that covers major unexpected medical costs. So sometimes you think of like AFLAC when you think of things like that. That's just one of the plans that offers like unexpected medical costs or exorbitant medical costs. You can supplement that with a different plan as well. So again, lots of research to do to make sure it's suited for you or you as an employer. But again, we're hoping that this information will allow you to check it out if you're interested. And to that point, we have a slide here with live links. So you'll get these in the slides when we send those out. But where can I find more information? Lots of places, as it turns out. And so we have a link to the American Academy of Family Physicians. That's a direct primary care model overview, so really good intro information. Then we have the DPC Alliance, which is good resources for employers themselves. We have an FAQ link for patients. We have Colorado-specific information, and so Colorado actually ran a bill, HB 171115, and that was where it discerned that direct primary care is different from insurance and has its own requirements and things. And so that's an interesting bill to get a history of how it's been in Colorado. And so we have that bill linked, and then we also have Colorado DPC and Colorado Health 2026 guide. Colorado DPC is a direct primary care provider, but also just has kind of taken on the role of providing information for direct primary care across Colorado. So it's a great place for resources. And also, if you're in the Denver metro area, it's a clinic that you could receive care at. And then the Colorado Health 2026 guide kind of helps you identify what direct primary care is going to look like in Colorado in 2026, which might be timely just given everything that's kind of going on, and perhaps marketplace premiums might be increasing. And so it might be a great option for folks just to be more informed about what their insurance might look like going into the new year. And last but not least, we have the Direct Primary Care Frontier Mapper. This is a national map, but you can search by zip code to see if there are direct primary care clinics near you. And so that is a great map. It shows a handful of clinics across Colorado, honestly, more than I kind of expected. It's familiar to me over here on the Western Slope because it's something I feel like we've been doing for a couple years, but I wasn't as familiar with the I-25 corridor. And you all have some resources. You have quite a few clinics there that are offering these services. So I just listed a couple here. Again, Colorado DPC, great resource, but also a provider. Pure Family Medicine, Peak Med, Stone Medical. That's all along the Front Range. We also have a couple in Colorado Springs, Pinnacle, Colorado Springs DPC, and then Alpenglow. And then on the Western Slope, we have Trailhead, and Trailhead is kind of peppered all over the Western Slope in terms of it's like one clinic, and then they have several different locations, which is helpful. And again, these are just a few of the ones, the big ones offering DPC. Many, many more can be found on that mapper link that we shared in the previous slide. But yeah, I'd encourage you to check it out just to see if you're interested. They have different membership fees depending on where you're at and what services they're able to offer in-house. So I can't really give you a, on average, you'll pay this much a month. But and typically they have different levels of membership that you can have too. So, 1 to 3 visits a month and blood work, or, unlimited visits and all the blood work you can want. So it's just, you can pick kind of your different levels in terms of what that clinic offers in-house. So yeah, that is the direct primary care overview that y'all had maybe hoped for in the September meeting. I think probably what is the most important thing to take away from this is that it's not insurance. It is not the same, and it doesn't offer the same things, but it could be helpful. And also the links that we shared are very helpful as well. And so we're going to send these out in the slides, but I am just going to drop them in the chat too. It looks really messy because it's all the links together, but there's all the links that were on the slide, and then you'll make sure you get access to those afterwards as well. But if you want to reach these links and this information a little sooner, you can pull them from the chat here. So any questions that I probably won't be able to answer for you, but I would love to try. It's a lot of information, I know. And I know we have a small group today, but has anyone used this or had access to this or even heard of it? I'm keeping an eye on the chat as well.
I haven't heard of it, but it's fascinating and I would love to learn more. So thank you for this.
Yeah, thanks, Jennifer. I think what was interesting to me is that we actually had some on the Western Slope. So it may only be one clinic that's offered, but I didn't know if it was going to be helpful for rural folks as much, but it looks like there are a few, again, peppered across our rural areas. So helpful to at least be aware. Perfect. Well, this information will be sent out. You can take some time to digest it, look through it. And yeah, if any other information comes around or you find anything when you're looking through this or have questions, we'd love to hear. We'd love to kind of do touch points on this throughout if there's additional questions. Again, this was just an overview. We didn't want to reach out to any individual clinics and have them come in because that, it is a business. And so we want to make sure that we're not, giving anybody a leg up and trying to get new people. But I'm guessing that you could reach out to them individually just to get more information on membership prices and information about your location specifically if you are interested. So I will take us into our next agenda item. So thank you so much for that. For suggesting that as a topic. It was interesting. So at this point, I will turn it over to Heather to talk to us a little bit about the Strategy Center Technical Assistance and where she's at with that.
Thank you, Brooke. So this is our second year applying for technical assistance from the Direct Care Workforce Strategy Center. Last year was the first year they rolled it out, and we participated in maybe a more intensive focus group last year on some work, and we were really doing some broader information and work on data infrastructure, and then also on our mentoring program, which we have now completed, and we'll be messaging that out for folks. This year, we applied under the technical assistance category of well-being at work, and we applied to be in the peer learning collaborative. And so we were selected, and we are in the collaborative with Alabama, Tennessee, Kansas, New Hampshire, and Puerto Rico. So every state and territory has their own uh, idea and plan they're working with. They all just kind of broadly fall under the well-being at work. We really wanted to focus our efforts on strengthening organizational culture and supporting providers in becoming an employer of choice. We're looking at how do you do with no more money, right? So how can we really support those folks? We know we have some great employers out there, and we'd really like to highlight what they're doing well in their structures, and we'd like to help other folks, other providers of all sizes, maybe learn from that and kind of share in best practices. And so our goals with this were to identify and define what an employer of choice means in our direct care workforce space, because it is a little bit different than other industries. We really wanted to get some research on it. We appreciate the technical assistance aspect from that, some stakeholder input, and just the support and really kind of fleshing out what we have. We want to incorporate an assessment of those pillars, those employee of choice pillars, into our existing surveys. We don't want to add more surveys, more burden, if you will, on getting this information, but we already do collect a lot of information. So how can we align those together to see what the results are? And then we really want to identify how we're measuring those and how employers themselves can measure, and then how we can report that information back out, at a state level. And I will talk real briefly on what we don't want this to be, because I think that is a big challenge for folks. We don't want it. It's not another compliance or regulatory program. It's not a mandate. It's just a way to highlight and recognize positive workplace culture, and to help other folks get to that level of positive workplace culture if they don't think they're there yet. It's not a one size fits all tool. We have a lot of different employer sizes and self-direction in this space. And so it's really challenging to make a one size fit all tool. We know it's not going to be a one size fit all tool, but really trying to get some input from across the employer sizes there. And our real goal is it's not a data exercise without action. So we want to be able to collect data and report that back out, and avoid metrics that aren't tied to tangible improvements. It's not driven by negative incentives or negative competition either. It's like, here's how we are growing and doing. And one of the other features we're really looking for some input on is not to make it culturally narrow or exclusionary. We know we have a lot of different folks in this space, and there's not one definition of what good culture is. So, that cultural competence piece in there. So just kind of pointing that out there. Sometimes it's hard to figure out what you want, but it's maybe easier to figure out what you don't want first and then work from there. So if you go on to the next slide, Brooke, I'll go over the pillars. We've got these pillars with a lot of research. So PHI, who's really active in the direct care and home and community-based space, doing a lot of research and a lot of data analysis. They have already done some work on this within direct care. So they shared some of their resources with us. We worked with Colorado Workforce Development Council's guidance. They already had some stuff out about employers of choice within the state of Colorado workplace. And then University of Minnesota's employment engagement survey, we were able to get some information from them. So we really looked for the common themes and how we could adapt them into Colorado's home and community-based workspace. So the five we have identified as our draft pillars are culture and mission, leadership and supervision, development and opportunity, compensation and rewards, and the fifth one is relationships and community. So if we go on to the next slide, we'll kind of break them down a little bit there. Culture and mission, some places have mission statements, some places don't. But we all have a mission, whether it's written down or not. And so really kind of looking at it at that lens, people do this work because they're motivated by a purpose. And so we really want to look for things that indicate that purpose. Our purpose is helping people stay independent and providing safe support and care in the home and community. The next one is leadership and supervision. This is, I think, a real challenging one in the direct care space because a lot of caregivers are working on their own. And they're in people's homes, they're working one-on-one with members, and they don't necessarily have colleagues there with them or supervisors with them all the time right there. And so how does that leadership and supervision look like when you are working alone? And the other aspect of here is how do we help grow and measure clear communication and accessible managers, someone to reach out to, also considering that this is 24/7 care. And so sometimes agencies really have to have, or employers have to have a plan for how to support workers when they're working maybe, out of the 9 to 5 area. I know there's lots of on-call situations out there, but really kind of wanting to look at those levels. If we go to the next slide, you'll see the other three pillars, development and opportunity. One thing we know and hear a lot is career pathways can be limited in direct care if you're thinking of a very consistent linear path up through an employer, because there's not a whole lot of options at top. There are smaller agencies that don't have multiple roles. And so just because there's not a career path to maybe travel in an upward trajectory within one employer, it doesn't mean that people can't still develop. And so we're looking at training and growth and what that looks like. And also that skill development is really important and it supports retention. Feeling confident in your work really helps you do that work and maybe take on additional work or find new interests within that work that ticks your box. Another real challenging one is compensation and rewards. Pay and benefits are something we hear about a lot. There's limited aspects to do a lot with that within the Medicaid space just because of our funding challenges. But we still have many people that desire to do this work, and we also understand that compensation can be outside of pay. And so we're looking at, in addition to fair wages, what are some non-monetary rewards that work for agencies? Some examples here is recognition. That's something easy to do across all levels, whether you have 1 employee or 500. But then examining, are you doing it well? Can you do it better? How can you do it better? How can people's actions be seen and recognized? Another suggested one there is flexible scheduling. Now that can be challenging in this space as well, because members' needs are what matters, and finding the way to meet the needs for the member is also super important. And is there creativity in flexibility around scheduling that can be an added perk, if you will, for that worker? And then the last one is relationships and communities. That is something I think we've heard a lot from our workforce and people in this space is people develop relationships with their members, with clients, with supervisors, with their peers. And they really look for that. And so finding ways to do that, and again, realizing that there could be limited peer interaction at that day-to-day level. So how can you really build that relationship and community support in there? So those are our 5 pillars and kind of how the explanations of how we arrived at those being what we're looking at. And so our next steps for this is really getting stakeholder feedback on these pillars. So we do have a survey, feedback survey open about these. It should be live now, and we will get some links shared out. We'll also keep it open through December 15th. We invite people to share it. One part of the survey is required, and the other part, and that's more of just clicking the boxes of how you rate some stuff. And then the other part is optional, and it's allowing free text in there to write in provide input and ideas and suggestions on that. It is an anonymous survey. We do ask for folks to identify their role. And so we can kind of look for themes across roles. Like I'm a worker, I'm a agency owner, I'm a member, I'm a family member, an advocate. Like how do you identify on that in that spectrum? And that kind of helps maybe us see where we might be missing the boat and explaining some stuff. And the other thing we do ask on the survey is just the county that you either live in and receive care in, or that you primarily work in. We're trying to get an idea on uh, how far our reach is and like where our input is coming, and then we can do some targeted outreach if we are missing certain roles or certain parts of the state. So the survey is one way to engage. Another way to engage is sending us an email if you'd like to participate further. This could look very different, right? It could be a focus group. It could be just maybe a Google Meet where you want to chat. Maybe it's an email where you want to share some resources. If you are doing this as an organization already and you feel like you have some strong points you'd like to share, we'd love to take that feedback. And so some of the questions we just put in here as a prompt is, what does a positive workplace or care environment look like to you? And that can look different depending on how you're coming to it and your experience. Another question we're asking or prompt is, what helps people feel respected, included, and supported? And we know that looks different for different folks. And so we're trying to cast a wide net to kind of look for some themes across that. How do leadership and everyday practices shape culture? I think that definitely the viewpoints from that can come from, your different roles. And we're looking at that. Maybe for some person, one bad interaction with a supervisor could really shape how they view that agency and that work. And for somebody else, it could be something completely different. We just kind of want to collect that and be aware of what folks are saying. Kind of with that, what gets in the way of a healthy culture? And then finally, what tells you an organization is a good place to work or receive care? So what are those key things you're looking at in a job post, in a website, in a social media post, when you go and visit, when you see those workers, what stands out to you? So kind of just looking for those identifiers there. And the next few slides, I just go over what is asked in the survey. If anyone wants to share any responses to this now in the chat or talk about it, we're happy to do it. But these are the questions that the survey really asks. It lists all the pillars, and it asks how easy they are to understand the description of the pillars. We ask, do the pillars reflect what matters most to the direct care workforce? And from your experience, does the pillar make sense for employers of different sizes? And I think, we know that's going to be one of our many challenges and opportunities of this is to really see from the different lenses of different sizes of employers. And I think we could probably also factor in regions, right, where you're at and what's going on in those regions could also impact this. On the next slide, we ask, is the wording clear and easy to understand? If not, I guess I didn't finish my sentence there. If not, please provide some feedback there. Are there other things that make an employer a great place to work that maybe we didn't capture in these pillars? Maybe we need to broaden the scope. And are there ways these pillars might affect some workers or employers differently that we should think about? Maybe one that stands out is, I have an agency and I would love to pay my workers more, but I can't. And that really affects a lot of the stuff. And so kind of knowing that, because then we can look at how do we help broaden the conversation about compensation, right? How do we look for other resources? Like Brooke just did a lot of research and a great presentation on the concierge medicine. Like, are there other resources that are already going on, other solutions that you can bring into your as an employer, be able to say, hey, I can't meet these needs, but here are some other options. So I'm not ignoring that need is still there. I'm just telling you other ways that you might be able to have those needs met and giving some folks some choices about that. So welcome to have any conversation about employers of choice. If anybody would like to chat about it, if not, please consider the survey and email Brooke and I, if you have any interest in this. We'd love to figure out how we can connect with folks and get their ideas and their input. And thank you.
Heather, how long does this, I should know this, but I'm going to ask you, how long is this PLC, this peer learning community? How long does this go?
I should know that as well. And I think we're about halfway through. It's about 6 months.
Okay,
And so we are about halfway through now. We will continue to work on it once the technical assistance goes away. It's something we strongly believe in picking things that we're going to work on, whether we get that support or not. If we get extra support, extra assistance, great. If not, these are still needs that we have prioritized and we want to follow through on. It just could maybe take longer if we don't have the resources to do it.
perfect.
We've made some great partnerships within the other states working in the collaborative and then with the subject matter experts. So I think we can always go back and ask, and with some targeted questions to folks and ask for more support if we need that going forward.
Perfect. Thanks, Heather. So I ask because I think we'll probably have a couple more touch points on this topic in upcoming meetings, just on where we're at in this process and where we're at in this build out, and then certainly provide updates at the end. Ideally, we'd love to be able to roll some of this into the Direct Care Worker Appreciation Week. So we're appreciating direct care workers during that week, but we're also doing some shout out to employers who do a good job of appreciating their workers too. So these pillars of these employers of choice, using these pillars, like if there's some employers that are doing an exceptional job, we'd love to be able to say, here's an employer that's doing the hard work to make sure their workers are appreciated as well in all these different ways. So I think we're trying to make it roll into that a little bit. So April sticks out to me, but stay tuned on that. Any other questions for Heather? Again, the survey and our emails in the chat. So, and we'll email the survey link out as well in the notes and the slides, just so you have that for follow up as well. Perfect. All right. We are just right on time, Heather. Excellent job. Kudos. We do have time for some open forum announcements. We did have a request from one of our co-chairs to just share some information on Medicaid resources and updates. It's an interesting time, both for our state budget and also federal changes. We're going into joint budget committee season, and our own budget was released earlier this month here in the state of Colorado. And then also all the changes with HR 1, the big beautiful bill. And so we have a couple resources here that is coming from our HICPUF communications team that will keep you updated as we know stuff. And so this is a good website, a good couple websites to bookmark, just to kind of be your source of update over the next couple of months. Typically in January, we will bring some information on maybe some bills or bill trackers. We collect a lot of different places that are tracking bills, and we'll share those resources with you typically in January and March. So be on the lookout for those as well. Not so much with our state budget stuff right now, but we did want to share these Medicaid resources and updates. So the first one is really department-wide, understanding the impact of federal changes to Medicaid. That's the entire Health First Colorado environment. And then the second one is really related to long-term services and supports and the Office of Community Living. So that kind of breaks it down a little bit more. So that's why there's two of those. But keep those on your radar. Any other announcements, resources to share, questions for our open forum?
I do want to bring up the care worker tax credit.
Yes, yes.
It did go out in the provider bulletin this month. We do have a FAQ on our page, and Department of Revenue has some of the forms on their page. So just wanting to call attention to that. There is a $1,200 tax credit, and it includes care workers in long-term care. And so that is a lot of the folks who are performing, many of the services within home and community-based care. Also, it does include facility, like long-term care facility staff. It does not include CNAs, so just making sure that is called out. The requirement that providers have is they have to send in a list of all of their employees that meet this tax credit. And if they don't, there is a fine. Department of Revenue does have a fine associated with that. So we are just trying to get the word out to folks. so providers know they have to fill this out and send it in. And then also for workers to know that this is a tax credit opportunity that they have. I believe the upper income limit for the tax credit is 70,000 for a single filer, 100,000 for a joint filer. Also falling within this tax credit are child care workers under early childhood. And so it's a little bit of a broad category, but just putting that on the radar. We are going to message all of the providers in our space to let them know if we think they fall into this requirement. It also does include self-directed folks under CDOS as well. And so for the CDOS folks, the fiscal management, the FMSs there are going to be helping with that. But for all the other workers, their employers will have to put this information in, send it in to Department of Revenue. So just flagging that for folks.
Perfect. Thank you, Heather. And in that same vein, we will actually have Get Ahead Colorado coming to our January compensation and benefits meeting. So this same meeting in a couple months in January, Get Ahead Colorado is going to come. They help with all sorts of tax credits, free tax filing. They're really well connected and they offer just a ton of economic mobility kind of resources and services. So if you'll remember earlier this year, we had them come and do a presentation on how to claim tax credits, what tax credits you might be eligible for. And so if you have questions on this care worker tax credit, be sure to join us in January because they're going to kind of help us message that, and they should have some information on being able to just apply for tax credits in general if that's something that's new to you as a worker. So great information upcoming in that January compensation and benefits action group meeting. And I should have the date and time on a future slide here for us before we go. Any other announcements or questions, ponderings? All right, hearing none, we will take us kind of to our closeout here in the last 10 minutes. So upcoming meetings, again, the next compensation and benefits action group meeting is going to be Friday, January 16th at 10 a.m., same time, same place. And so we'd love to see you for that Get Ahead Colorado presentation. There'll be time for questions. If you have particular questions that you might like to ask them just about tax filing and tax season and credits and things, shoot those over to our email address and we can make sure that they include those in their presentation. So just a call out for anything specific you'd like them to cover, we can certainly have them do that. Breaking news, I would say, I think you all might be the first to know about this officially. Our next Direct Care Workforce Collaborative is going to fall in a new schedule. So typically we would have it on December 10th. But if you remember the last couple of years, we have had to reschedule that consistently because of our joint budget committee hearings. And so instead of continuing to reschedule that every December, we decided that we are going to have a new quarterly cadence. And so we are going to start in January and have collaboratives January, April, July, and October. This is twofold. December is tough without JBC complications and hearing schedules. Holidays are tough. December is our consistently lowest attended collaborative throughout the year. But in turn with that, the other reason too, the other nice thing is that January and July starts that calendar year and also starts the state fiscal year. So we feel like those updates that might be timely that are implemented on January 1st or July 1st, the messaging of those might be more timely if we have a more consistent collaborative schedule that falls within those. So having a January meeting and a July meeting, we feel like allows us to get information to you a little bit quicker. So you're not waiting a month or two to get anything that's maybe starting on those days. So we're hopeful that it will work. If it doesn't, we're going to solicit some feedback probably halfway through the year and see if this new schedule works. If it doesn't, we'll go back to the drawing board, get some stakeholder feedback and see what works best. But we're hopeful that this new schedule will work by just avoiding December altogether. And so with that, our next meeting will be Wednesday, January 14th at 10 a.m. So just a couple days before our next compensation and benefits action group meeting. We'll be meeting together as a collaborative after the first of the year. We'll kick it off together and we'll see how that new schedule goes. So you'll see some messaging coming out probably in the OCL newsletter. You'll get an email. Calendar invites will change. The action groups will remain on the same schedule though. So those won't change, but we will just change that quarterly meeting, shift it a little bit. So fingers crossed that that works well for schedules, better than December. Some resources. Again, I've starred the two federal and state Medicaid keeping track of changes. And then I'll go ahead and drop these other links in the chat as well. But again, they'll be included in the notes and slides when those come out. But just in case you want them right now, they're there to you to have. And with that, I think, yes, thank you. Happy Thanksgiving. Have a wonderful week, weekend, restful time off with family, friends, hopefully, whatever fills your cup. We hope you're able to do. And yeah, thanks for being here. And we will see you, after the first of the year. So thanks so much. We'll talk to you soon.
I love the dancing turkey.
I think it has a football helmet on. I'm not sure, but I
Oh,
liked it. So
there's football on Thursday as well.
yeah,
It works. It works.
he's ready. So thanks,
Thank you,
everyone.
Greg.
All right. Thanks, Tom. Thanks, Wendell. We'll see you later.